This is the second part of the urinary system, and we're going to start with renal calculi, which is another name for kidney stones. These result when urine becomes too concentrated and substances in the urine crystallize to form stones. Symptoms arise when the stone begins to move down the ureter, causing intense pain. Another name for them are uroliths. Most stones develop in the kidney and are made of calcium salts, found in the kidney, ureters, bladder, or urethra. The symptoms are hematuria, extreme flank pain, and obstruction may lead to hydronephrosis, the most common cause of urinary obstruction. If calculi are in renal pelvis or the calyces, pain is duller or more constant. If a stone fragment lodges in a ureter, you will see intense flank pain and urinary urgency. The diagnosis is made by an IVP, which is an intravenous pyelogram, KUB, which is the kidneys, ureter, and bladder, renal ultrasound, urinalysis, CT scan, abdominal X-ray, or an MRI. Now, calcium phosphate or calcium oxalate crystals may separate out from the urine. They grow too large to pass out of body. The treatment, conservative treatment is just increase the fluid intake and pain medication. Surgically, you can do what they call a stone basket procedure, passing a retrieval instrument into the urethra, bladder, and then the ureter. Lithotripsy is focused sound waves as patient is immersed in water, breaks up the stones to be passed. Treatment is directed at clearing obstructive stones and preventing the formation of new ones. Okay, and these are just some home remedies. So I saw this. Acute renal failure. This is a sudden and severe reduction in renal function. Nitrogenous waste products quickly accumulate in the blood, leads to an acute uremic episode. Acute tubular necrosis is the most common cause of acute renal failure in critically ill patients, rapid destruction or degeneration of renal tubules. So we have prerenal, intrarenal, and postrenal. So some prerenal is a sudden and severe drop in blood pressure or interruption of blood flow to the kidneys from severe injury or illness, and you can get this from hypertension or hypovolemia. Intrarenal is direct damage to the kidneys, and it can be ischemic, which decreases the perfusion, or nephrotoxic. Some drugs that can cause nephrotoxicity is the antibiotic and aminoglycoside. And postrenal, obstruction of urine flow, okay, benign prostatic hyperplasia, prostate cancer in the male, and stones, and in the female, cervical cancer can cause that. Chronic renal failure. This is a gradual and progressive loss of nephrons. It's an irreversible loss of renal function, gradual onset of uremia. As the kidney tissue is progressively destroyed, it loses its ability to excrete nitrogenous waste products such as urea and creatinine, which accumulate in the blood, eventually reaching toxic levels. So in progressive chronic renal disease, it's also known as end-stage renal disease, or ESRD. Okay, and these are some symptoms: vomiting, not feeling hungry, weakness, sleep problem, changes in urine, hiccups, swelling of the feet, itching, chest pain, and shortness of breath. Stress incontinence. In stress and there are two muscles involved in control of urine flow. The sphincter. This is a circular muscle surrounding the urethra. You squeeze this muscle to prevent urine from leaking out. And the detrusor muscle, the muscle of the bladder wall. This must stay relaxed so that the bladder can expand. In stress incontinence, these muscles are weakened. So it's primarily a bladder sphincter dysfunction. You have an involuntary loss of urine when you cough, sneeze, or rise quickly. Okay. The risk factors are aging, multiple childbirths, medications, obesity, trauma, and neurogenic problems. Neurogenic bladder. It's a communication between the brain and the bladder. So the bladder does not empty properly due to a neurological condition. The link between the bladder and the part of the nervous system that controls the bladder is broken. It can be due to CVA, which is cerebrovascular accidents, another name for a stroke, a spinal cord trauma, herniated lumbar disc, myelomeningocele, or neuropathies. The nerves that carry signals from the bladder to the brain and from the brain to the muscles either do not function properly or fail to send the proper signal. Diabetic nephropathy. Renal changes or glomerular sclerosis resulting from diabetes mellitus. The glomeruli become leaky and at first allow only small amounts of protein to pass into the urine, which is called microalbuminuria. And microalbuminuria is defined as 30 to 300 milligrams per 24 hours. Without treatment, the ability of the glomeruli to keep protein out of urine declines, and eventually the person has albuminuria, greater than 300 milligrams of protein per 24 hours. The major symptoms are albuminuria, declining glomerular filtration rate, hypertension. So 15 to 20% of people with type 2 diabetes will develop diabetic nephropathy. Renal cell carcinoma, this is a primary tumor of the kidney, occurs in the renal cortex. The risk factors are smoking, obesity, dialysis patients, and prolonged exposure to asbestos and cadmium. And that's it. Thank you.